Hi, here we are going to discuss about the respiratory disorders. And the major respiratory disorders are, we can see the respiratory disorder are a disease which affect mainly the respiratory system of our human body. Materials inhaled in the workplace lead to major chronic diseases, and it's mainly affect the respiratory system of a human. Irrespective of the environment of workplace, the employees are getting infected with the diseases, and lungs are the most affected organ of our respiratory system. And here we can see the common diseases that affect the respiratory system are workplace asthma, chronic obstructive pulmonary diseases, interstitial and fibrotic lung disease, hypersensitivity pneumonitis, lung cancer and infections. And these are the major signs and symptoms of the respiratory disorders like dry and scratchy, sore throat, running nose, cough, fever, chest pain and its tightness, and the breathing problems and the shortness of breath while doing any physical activities. And these are the disease diagnosing for different kind of respiratory issues. Chest X-ray for the bones, organs, and tissues. Pulmonary functions test for the breathe and in and out capability. Blood gas test for checking the infections and disorders in blood level of oxygen and carbon dioxide in blood. CT scan for diagnosing the lung diseases. Bronchoscopy test for lung issues and checking the airways of the lungs and blockages in the lungs. These are the major tests for respiratory diagnosing. And the next step of respiratory diseases will discuss Gurkirat Singh.
Hi. Now let's understand the what are the various causes for the respiratory disease. The number one is the dust from the wood, like working in the workplace, in the silica and coal and cotton, etc. Even the various flavors of the like when we're cooking food, that can also cause a problem to several persons. And the next one is the fumes from metals, like when the metals are heated and cooled, then they release the fine particles into the air like some processes include metal cutting and welding, smelting, and where the furnace works, and it can release some fine particles that can be inhaled deep into the lung and can cause severe problems. And next one is the smoke from the burning particles that can also lead to various diseases. And the next one are the toxic gases like ammonia, ammonium chloride, sulfur dioxide, carbon dioxide, and nitrogen oxides. And these gases are very harmful for the respiratory and our lungs. And the next is the vapors and spray, another form that can be inhaled into our lungs from the various workplaces. And the next one is how to treat for the respiratory disease. Like treatment is the for the most lung disease is not effective, as the whenever the lung tissue gets damaged, it can be repaired to the into a normal position easily, but we can reduce the symptoms by reducing the exposure to the toxic gases and fumes. In like we can move the person from the higher toxic emissions to the like where there's a no emission. Sometimes the lower emission can also affect the person very badly. The employer should also take the proper steps to lower or eliminate the toxic gases or the fine particles from the workplace and monitor the workplace deeply to reduce or eliminate these type of disease. And the next one is how to prevent this disease. Like the for the prevention, the number one is and the we should properly service all the environmental hazards and medical hazards. And the next one is hazard removal. The hazard should be removed with the proper techniques and proper PPE, and the proper training and education must be provided to the new workers, and after some specific time the training should also be given again, like to train the workers properly. And the next one is a proper use of PPE like respirators, mask while working, so we can prevent this type of disease in the workplace. Now next, Jupin will talk about it.
Hi. I'm talking about the preventions, like according to the disease. Each disease has its own method of prevention and treatments. So some of the common diseases are like asthma. Asthma, the common treatments like controlling inhalers, and doctors teach them manage to the intensity of the symptoms by doing exercise, meditation, and avoiding cold weather. And the other common issue is lung cancer. It's basically depends upon basically depend upon the treatment type of the cancer and in which stage the cancer is in. And treatment includes basically the surgery, chemotherapy, and radiation. Other disease is chronic optic pulmonary disease. Treatment for COPD is mainly by meditation, and surgery is also a suggestion for extreme cases. It is caused by inhaling the pollutant gas, chemicals, and smoking, as we discussed before. So the best way to is to avoid these situations in future, and so by that way they can reduce the symptoms. The next one is the pulmonary hypertension. Medication is also a major thing for this, and there is no cure. Like most of the respiratory diseases has no cure, and only way is to reduce the symptoms. So the only thing is to do is to avoid future exposure to the chemicals and the toxic gases. Some of the employer responsibilities we should talk about is the workers who are affected by the respiratory injuries will be feeling difficult, of course, and when working in winter times, basically. So they should support them in all difficult times, and absenteeism can be also an increase as they are diagnosed with the injury or respiratory disease, and provide job according to the previous job responsibility and pay if the worker's previous job is not available. Employees cooperation is based on the worker's condition and joins according to his workplace safety. Yeah, the employer should give him like proper accommodation to the worker so that he can work safely, and frequent health and safety assessment should be carried out. Assessment for worker job and provide any indicators if work is alone, and if anything happens wrong, then workers can let us know, and they should take appropriate emergency actions for it. Coming to the next slide, is mainly about the worker accommodation when a worker is diagnosed with a disease, and he's when he's coming back to work after like a short time of period or short or long term. So worker accommodation, a worker with respect to the environment of the workplace should be neat and clean. He should not be working in the same field where he used to work before. He should be working in a like free, smoke free or substance free environment, and he should be in a smoke free environment, of course, and provide breaks for medication. Providing breaks is a good idea. Provide office on the ground floor for avoiding long walks and stays. Workstation and working material should be in close range so that he do not need to do any more physical activities that can affect his stamina and respiratory organs, and providing appropriate mode of communication like a phone or something in case of emergency. So basically this was our assignment, and thank you for listening to us, and everyone work safely. Thank you.
Thank you.